Then number 9, return to play. The objective of rehabilitation is for the athlete to return to play or activity as soon as safely as possible. Returning too soon can lead to permanent damage or to further damage to the injured part. Athletes recover from injury at different rates, and returning to physical activity is determined by how soon the injury recovers, not by how many days or weeks have passed since the injury has occurred. It also depends on how serious the injury is. The use of opinions from doctors and physiotherapists will assist in this process. There are indicators as to when an athlete should return to play, and these include pain-free and full range of motion, return of strength. For example, if the injury was to the ankle should be about the equal of the opposite side before returning to full activity. Minimal pain or swelling. Some mild discomfort, stiffness and or swelling can occur during after exercise, and this will respond well to ice therapy. Functional training. The athlete should be able to perform the specific motions and actions required for the sport effectively before returning to activity. Again, with the ankle injury, retraining an ankle in football would involve the ability to run, to stop, to change direction, to jump and to strike the ball. Finally, mental confidence in the ability to do the exercise. The athlete must feel that the injured ankle is ready to perform at the level required for that particular sport. Monitoring progress. This will occur through pre and post testing. The athlete's progress during rehabilitation should be continually monitored. The severity of the injury will depend on the intensity of the process, and clinical tests may need to be administered to ensure that the progression is undertaken at an optimal rate. Pre and post testing is promoted to gauge the progress of the injury. A severe ankle injury test will initially involve measuring the range of movement of the joint, its strength and its mobility without pain. Progress should be monitored during all training sessions. Prior to returning to competition, the athlete should be put through a series of tests that involve sport-specific movements associated with the sport. Response elements for strength, power, endurance, and proprioception, which is the joint's awareness of its position, should be analysed during these testing performances. Psychological readiness. In many ways, confidence is the opposite of anxiety. The longer the athlete is away from training and competition, the more likely the loss of confidence in their ability to get back on top of their physical fitness and mental game. During this time, the athlete and coaching staff could benefit from the assistance of a sports psychologist to work with them to identify specific aspects of the sport that the athlete has lost confidence in. This information will be included in the progressive program of performance simulations, training tests, and other assessments to evaluate the strength and durability of the rehabilitated body injury and the readiness of the athlete. This evidence will help restore the athlete's confidence or otherwise identify areas that still warrant attention. Specific warm-up procedures. Specific warm-up programs are often developed by the sports coach, trainer, or other health professionals in collaboration with the athlete to achieve maximum recovery and minimise further or re-injury. Considerations to the injury site may include a longer, more specific stretch and a warm-up routine to ensure that adequate blood flow and increased flexibility has occurred. Return to play policies and procedures. It's recommended that the procedures for return to play include establishing a chain of command regarding the decision to return an injured athlete to training or competition, communicating the return to play process to the athlete's family, certified trainers, coaches, administrators and other healthcare providers, establishing a system for documentation, establishing protocols to release information regarding the athlete's ability to return to training or competition following the injury. It's essential that return to play policies address the following: the safety of the athlete, the potential risk to the safety of other participants, the functional capabilities of the athlete, the functional requirements of the athlete's sport. There may be federal, state, local, school and governing body regulations pertaining to the return of an injured athlete to training or competition, particularly in regard to head injuries. Ethical considerations. This would include the pressure to participate and the use of painkillers. When is the right time to return to play? In high-profile competitive sport, elite athletes on lucrative contracts or with major competitions ahead may experience certain pressures to compete. Large amounts of money are spent to get the athlete back to a competition level, as the athlete may feature heavily in the team or the coach's game plan. Deep-seated pressure on the athlete could include the fear of losing their position in the team or striving for particular external rewards, and this could lead to the use of painkilling or other drugs to continue playing. This is a dangerous issue if the athlete is inexperienced and disregards medical advice in the urgent request to participate in their chosen sport. For children and young adults, parents and inexperienced coaches and trainers can cause additional injury by applying undue pressure to the athlete to play if they've not fully recovered from their injury. Some injuries, regardless of ethical issues, require the following documented procedures before returning to participation. If concussion occurs, the Sport Concussion Assessment Tool, the SCAT tool, should be used to assess the player and to seek medical advice. This test includes a memory and cognitive and neurological screen test. As for all head injuries, this should be applied.